Hypotension, the symptoms and causes of low blood pressure. How to manage low blood pressure. This video is about the symptoms and causes of hypotension, known as low blood pressure. There are 6 key features regarding low blood pressure, including the diagnosis and treatment of hypotension. So, is low blood pressure dangerous and how's it corrected? Low blood pressure or hypotension describes a condition where your blood pressure is much lower than what is deemed normal. Typical symptoms include nausea, lightheadedness, and dizziness. When a person is hypotensive, their systolic or contracted blood pressure reading is usually below 90 mm Hg, millimeter of mercury, while the diastolic or relaxed blood pressure reading goes below 60 mm Hg. The 6 key features of low blood pressure are: Number 1. The symptoms. This can include any of the following. 1. Blurry vision. 2. Fatigue. 3. Pale skin. 4. Fainting, dizziness, and blacking out. 5. Shallow and rapid breathing. 6. Cold and clammy skin. 7. Unsteadiness. 8. Palpitations. 9. Confusion. 10. Difficulty concentrating. 11. Unusual thirst. 12. Chest pain, and 13. Light-headedness. Number 2. The diagnosis. To check whether a person has hypotension, a doctor will check their blood pressure reading while the patient is standing up and while lying down. Hypotensive individuals will usually experience lightheadedness or dizziness when asked to stand up from a lying position. Number 3. The causes. This includes 1. Dehydration, which reduces the volume of blood as a reaction to body heat, by pushing blood out to the skin vessels. 2. Pregnancy, especially in the first 24 weeks, while more blood is redirected to the fetus, and the mother's blood vessels expand. 3. Too long spent in bed, which affects bedridden people. 4. Fear. 5. Emotional stress, and 6. Certain medications. Number 4. The treatment. The treatment for low blood pressure or hypotension may vary, depending on what causes the blood pressure to be low. A doctor will also take into consideration the severity, as well as the frequency, of the symptoms. While the aim is to return blood pressure to normal and to relieve the signs and symptoms of low blood pressure, treatment goals should include managing the symptoms of the underlying condition that causes hypotension. The effectiveness of the chosen treatment will depend on the patient's age, existing medical condition, overall health, and the body's reaction to the effects of medications when these are stopped, started, or when the dosage is changed. Number 5. When low blood pressure is not considered dangerous. Having low blood pressure is usually linked to a lower risk of severe conditions such as kidney disease, stroke, and other heart problems. People who consciously maintain their body weight by exercising regularly, eating healthy unprocessed foods, avoiding smoking and alcohol abuse, and having their cellular health in balance, generally have lower blood pressure compared to their unhealthy counterparts. These healthier individuals are less likely to experience any adverse symptoms associated with having lower blood pressure. If the only symptom of low blood pressure is the actual BP reading, this isn't necessarily a cause for concern. However, if anyone experiences any or some of the symptoms listed above, a visit to the doctor should be arranged. Even if under medical care, or if aware of the condition, a doctor should be seen again if there's any increased frequency and intensity of the symptoms. Number 6. Factors that influence blood pressure. The 2 physical factors that influence blood pressure are the nature and condition of the blood vessels and the actual blood volume. If the blood vessels are rigid and constricted, due to unhealthy fatty deposits, for example, it means the heart must pump harder in an attempt to deliver the blood. This will cause blood pressure to be higher than normal. One blood marker to check on is the percentage of healthy essential fats of total fats in the blood. Referred to as the omega-3 index, a percentage reading of 8% and above helps to indicate the normal function of the heart. Consequently, more and more people throughout the world are increasingly at risk of high blood pressure, owing to a modern-day diet of processed and ultra-processed foods. However, if blood volume is lower than it might typically be, or the heart is pumping effectively, any blood pressure reading could be less than expected. So, The important factor to focus on with regard to having high or low blood pressure is your diet. Summary and conclusion. Ideally, your blood pressure should be no more than 120/80ths of a millimeter of mercury, and no less than 90/60ths of a millimeter of mercury. If it's lower, but not extremely so, then that's considered less dangerous to your health than having high blood pressure. However, if it's low enough to cause noticeable symptoms, it can be dangerous and should be brought to the attention of a doctor. But do bear in mind that managing your blood pressure levels is ultimately down to you. For example, it's your responsibility to exercise regularly, eat healthy food, such as fresh and seasonal fruit, vegetables, legumes, and lean meat, keep alcohol intake to an absolute minimum, and sleep sensibly. And remember, focus on the root cause of any high blood pressure problems, and not solely on the symptoms, to get your cellular and overall health back into balance, and your blood pressure down. We hope you found this video, Hypotension, the symptoms and causes of low blood pressure, helpful and of interest. Please feel free to give it a thumbs up, leave a comment or pose a question, especially if you'd like to share some of your own low blood pressure experiences and tips below the video. And share with people you think will find the video worth watching. And if you're interested in finding out more about the secrets of heart health, become an exclusive subscriber of this channel. Just click the subscribe button in the bottom right corner of this video, and then click the grey bell icon to be notified of future videos being uploaded to the Natural Health Guys channel. You can check out other videos in this series by clicking on the end screen coming up. And finally, many thanks for watching.